There seems to be a great deal of concern bordering on panic already. Is it worth it?
Well, this Delta variant is more transmissible, significantly more transmissible than the Alpha variant, which was the one from the UK, which was even more transmissible than the original virus that circulated. So we're seeing increasing transmissibility. We're concerned that we may see increasing pathogenicity, that is just, more disease causing, not just transmission, but make people sicker. And
pardon me, Dr. John, excuse me.
Yep.
If you can explain this to me that I can understand it with my limited education, how is one virus more contagious or transmissible than another?
Right. Well, what it is that it's, an infection with a virus takes a certain number of virus particles as part of it. And so it's kind of, dependent on the dose you get exposed to, whether you get infected or not. And so that's a big part of it. And basically, increased transmissibility means that fewer virus particles are needed for a person to get infected.
But the Delta is less severe, I guess, in symptoms. Is that right?
No, it's not. It's not any less severe. And what we're seeing, is increasing hospitalization now, mostly among people who are unvaccinated. But we are seeing what we call breakthrough infections. That is, people who are vaccinated getting sick with the Delta variant also.
Doc, there are numbers that are coming out saying that the cases are now up by about 50% across the nation. Are we seeing the same numbers in Louisiana?
Yes, we are. We've gone from 100 cases a day to over 1,200 cases a day in Louisiana. So we're seeing a lot more infections now, and locally as well as statewide. And that's concerning. This is a big surge in infection.
I've, as you know, I've had COVID. I've been vaccinated. I probably have more antibodies than we have immigrants at the border. Am I safe?
So it depends on how you define safe. Could you get infected with the Delta variant? Possibly. Are you likely to end up very sick, that is, hospitalized? No, not likely. Again, it's possible. Risk is never going to be zero, right? But you could get infected with the Delta variant, possibly.
Dr. John Vanchiere, New Orleans is already now talking about possibly some new restrictions. If it is your advice to the governor or to other leaders, would you say we really need to probably start looking at that again and maybe implementing some more restrictions, or go back a little bit to our stages?
Well, I think it definitely is under consideration, and I think the most important things right now are people who are not vaccinated should get vaccinated. That is their best protection against severe disease.
What's the hesitancy?
Still a lot of hesitancy. Only 1 out of 3 people in our area is vaccinated, and that's part of the reason that this surge is happening. We talked about this, 6 months ago. The faster we vaccinate, the quicker we can shut down and prevent variants from emerging, and that just hadn't happened. And a lot of folks believe this pandemic is over, but it's not. We might be halfway through the pandemic.
Doc, if theoretically I'm vaccinated and I can get the Delta variant, and Erin's not vaccinated and she can get the Delta variant, what's the point in vaccination?
But I'm vaccinated, for what it's worth.
So the point of vaccination is a few things. Number one, vaccine prevents severe disease. So vaccines save lives, number one. Number two, vaccines reduce the severity of your infection even if you do get infected. And number three, reduces the transmission of the virus in the community. So you're not going to be a spreader if you're vaccinated, or less likely to be a spreader if you're vaccinated. So all of those things, vaccines are critically important to saving lives, and that's really what we want to focus on. We are seeing now a large number of young adults, less than age 40, who are not vaccinated, and we know that that's the demographic that is more likely to now get sick and end up in the hospital. So,
Doctor,
we want to save lives. We want to save lives.
You just said, you slipped something in before that last question that it's just pounding me in the brain. We're about halfway through this pandemic.
Uh-huh.
You have got to be kidding me. We all thought we're on the final leg of the race. We've got another year?
Probably so. Yeah. And in my estimation, because this is exactly what we talked about 6 months ago. We've got to get vaccinated to prevent this lingering, death by 1,000 cuts or pandemic with 1,000 cuts kind of situation. And variants are going to continue to emerge as long as people are not vaccinated.